Hi, my name's Jill Burig, and my presentation is on the widened gap in healthcare throughout South Africa. Healthcare varies in South Africa between the private and public sectors. The reason why the gap exists is because many people cannot afford private healthcare, as public healthcare is free. So what's South Africa going to do about this? So first I'll explain the private healthcare. Private healthcare is very commercial. It has the best and most doctors, and it receives 50% of the total healthcare spending by the government. But only 15% of the population belongs to the private sector. But many people aspire to become on the part of the private sector because they have the best doctors and the best resources. The hospitals are located in the wealthier provinces, and they have 2 times as many doctors and 4 times as many hospitals with more suitable supplies. So the kinds of people that are on private healthcare plans are the white upper middle class and upper class citizens. The public sector provides basic healthcare to 80% of the population. So that's 35 million people, but they're only getting 50% of the money from the government. So the facilities are located in townships, which are impoverished areas, and they're all public hospitals. They do not have the same quality, and they have the highest demand because most people are part of the public sector, but they have the smallest amount of inadequate resources, poor building conditions, and broken equipment. People that are on the public health care plan have the most cases of HIV and tuberculosis. This could be because they are uneducated or they just don't have the access that they need to suitable health care. So what is HIV? HIV is contracted for life, and it never goes away. It's contracted by sharing needles or unprotected sex or swapping of bodily fluids, such as blood, and it's also transmitted from mother to child. Females are 2 times as more likely to get HIV than men. The highest prevalence of HIV in the world is Black African females ages 20 to 34. In Half the Sky, we read that 21% of South African women have been raped before the age of 15. So this could add to the reason why HIV is so prevalent in South Africa. So what is tuberculosis? Tuberculosis is a bacterial infection that can spread through the bloodstream and lymph nodes to any organ, and it's mostly found in the lungs, but it's transmitted through the air. So out of 500,000 HIV cases in South Africa, 330, which is 66% of the people that have HIV, have tuberculosis as well. These people are, again, either uneducated about prevention or they don't have access to the healthcare necessary. It can be said that HIV and TB are the root of the healthcare problem because there are so many people who have HIV and TB but not enough facilities. So to compare this, per 1,000 people in South Africa, there are only 0.8 doctors. But for every 1,000 people in America, there are 2.5 doctors. So that's more than 3 times as many doctors that we have in the United States than that they have in South Africa. The Freedom Charter, which we all read, is a statement of the core principles of South Africa. In the Freedom Charter, it says that free medical care and hospitalization shall be provided for all. But the private healthcare sector is a lot of money, so a lot of people can't afford it. If this were abided by, blacks and whites, impoverished and wealthy, would all be entitled to the same healthcare. It's adding to a divide in South Africa. So how do they plan to fix this? South Africa, the government has implemented a 10-point plan, which includes a national health insurance scheme that will be phased over 14 years and will promote equity and efficiency to make sure all South Africans have affordable, quality healthcare services, regardless of employment status or the ability to make direct monetary contributions to the NHI fund. It will also educate people about HIV and TB and increase life expectancy. So what can we do about this? We need to empower women because women don't have all of their rights in South Africa, and you can see that in America, most healthcare providers, such as nurses or occupational therapists, are women. So if women are able to have their rights and become educated, they can become healthcare professionals and aid to the better healthcare in South Africa.